Hello, my name is Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure to be with you today. We have a special guest here in our little video series, Dr. Ricky Miller. Dr. Miller, who we'll let explain where he's from and all of that, is a local guy that very well trained. He's really an expert in radiology, and beyond radiology or radiologist, he has a fellowship in procedures that are very advanced, and we want to talk about that as well. But as we begin here today, I'd invite Dr. Miller just to introduce himself.
Thank you, sir. Thanks for the introduction. Like you mentioned, Ricky Miller. I'm from Houma, Louisiana. Grew up on the bayou, so fished, hunted all my life. Still an avid fisherman. Graduated from Terrebonne High, as well as Nicholls State University, just down the road here. Went off to receive my medical education at LSU Health in Shreveport, and then received my medical training at LSU Health Science Center in New Orleans, where I completed a specialty training in interventional radiology.
Great. Why don't we talk about that for a moment or two? So you go to school for 4 years for a medical degree, you become a physician.
Correct.
Then you do a residency, and a residency is more into your specialty area, it's a focus. And the residency for a radiologist is how many years?
It's 5 years total.
5 years, so it's no small amount of time. And then the fellowship is an additional
year. Correct.
Yeah, so 6 years beyond medical school is a lot of training, and you get a lot of practice opportunities, and you're actually doing the care for a good part of that. Would that be right?
Absolutely. Lots of learning potential, lots of experience. 6 years after graduation of medical school and a subspecialty, receiving subspecialty training, top-notch facility.
Great stuff.
Excellent learning.
So let's talk for a minute or two about the fellowship. Having noted 5 years of residency, it's a lot of training. What made you choose to want to be, what made you want to be a interventional radiologist?
I like to think of interventional radiology as a doctor's doctor. We work alongside in partnership with nearly every subspecialty in the hospital to some capacity. So we help other doctors provide better medical care to their patients.
So in this region, the 7 parishes or so that we serve, there aren't any other interventional radiologists. So there's not sort of one of those doctors on every corner. And it's very specialized, and the training is very particular. But it enables you to do procedures too, right? Why don't you talk about that for a minute? We're going to talk later about the new technology that you'll utilize. But in a general sense, rather than just reading the images only, you're able to do procedures.
Right. So that additional subspecialty training allows us to utilize imaging. So we use an ultrasound machine, a CT machine, and we perform procedures using that. That allows us to provide the least invasive procedure possible today. So we could actually see inside of the patient's body while we're performing our procedure. This reduces complications that can be associated with larger open procedures. It lessens pain, it shortens recovery time, and hospital stays.
That's a huge win for the patient and for really everybody, right? Regional, this Dr. Ricky Miller. Dr. Miller is again an interventional radiologist, 5 years of training in a residency, another year more on the interventional side. He's really an expert in his field. He's the only one in the 7 parish area, and we're really pleased to have him on our medical staff at Thibodaux Regional.